Good evening, friends. I take immense pleasure and honor in introducing my brother today. He doesn't need introduction at all, but still, it's a formality, and it's a thing of honor for me to praise to speak few words about today's speaker, none other than Dr. Syed Tanveer Hussain. He has done PHMS. Friends, Dr. Tanveer Hussain has done Mathematica, Organ of Medicine, Repertory. He has done PhD in postgraduate in. He has done PhD. He's a postgraduate in integrated oncology. Okay, he has done fellowship in palliative care, ozone therapy. He has done diploma in naturotherapy and yoga. He has special interest in cancer cases. I have heard a lot about Tanveer Hussain sir, about his skills on the cancer. Okay, he's been holding so many positions. I'll name the few: chief consultant, Dr. Tanvir's Homeopathic Cancer Care Center. He's the national president of IIHP. That is the biggest organization of homeopathy in India, Indian Institute of Homeopathic Physicians. He is the president, national president for 2023 to 2025. He is a visiting professor in Lord Mahavira Holistic Medical College, Ludhiana. He is district vice chair, Cancer Awareness Committee 2023 to 2024, Rotary International District 3090. He is a former guide of Hahnemann School of Homeopathy, London. He is the author of one of the bestsellers of homeopathy, which is there on 50 millisievert potency. The title of the book is 50 millisievert potency, a silent and showering spring. He has received more than 25 awards in state, national, and international seminars, conferences, workshops. Dr. L.M. Khan sir, who is our idol, he says Dr. Tanveer is Sachin Tendulkar of homeopathy. And he is friend of my guru, Dr. Motiwala sir. Dr. Motiwala sir also talks so tall about you, Tanveer bhai. I feel so very proud. When last time when he came, we met in the conference in Delhi. Motiwala sir was speaking so much about him, and then I said, he asked me, "Do you know Tanveer? Do you know Dr. Tanveer?" I said, "He's my brother. He's my friend." So I was like, "यार तेरा कौन दोस्त नहीं?" मैं क्या सर सौभाग्य है ये तो ऊपर वाले की मेहर है कि मेरा जुड़ जाते हैं. So I'm so proud of you, Tanveer bhai, and I'm so happy to introduce you, mashallah. Thank you for blessing this. Friends, this is the 91st lecture of our Guru Ke Saath Guruvar series, which we started 2 years back in June. It's coming to an end after maybe 9 lectures, and we are now fortunate to hear from the pearls of homeopathy, and one of the shining stars of Indian homeopathy, the fraternity of homeopaths in India, about whom we are very proud, Dr. Tanveer Hussain Khan. Tanveer bhai, over to you.
Thank you so much, Jakat Bhai, for this sweet introduction. It's all because you love me. That's why you speak so high about me. I am just like a student of homeopathy. Yesterday also I spoke to Dr. Patil where she was praising me and all. I said, no, I'm just learning homeopathy because there is a lot of literature pending now, and the life is too short to know the maximum of this one. Once I asked one of my teacher, respected Dr. Ramanlal Patel of Vadodara or Kottayam, the person who has maximum number of cancer cases treated in his credit. Sir, how much homeopathy you know? At the age of 93, he told me, Dr. Tanveer, I know about homeopathy about 30 to 35%. And he is a honeyman of homeopathy in India.
Yeah,
so this is so vast, this is so deep, this is very ultimate thing. Dr. Honeyman was ahead of his time when he invented this homeopathy. And as far as Dr. Farooq Motiwala sir is concerned, we have been together. Jakat bhai, there was one film made by American producer and director. It is on cancer. If you find some time, you just watch it. It's very interesting. And know that Eastern medicines, 7 days in 7 countries.
Yes.
It is Tai Bolengar. If you just Google the name of the person who is director and producer of the movie, Tai Bollinger.
Yes.
He is
Yeah.
working tremendously on cancer patients and cancer topic. He invited 7 people from India for that interview in that movie. Luckily, me and Farooq Motiwala were there in Bangkok for 3-4 days with him. So we have close association with all these. So now coming to the topic, now I will ask you to share my screen. Shall I start with that directly now?
Please do. Please do.
Okay, thank you very much. Thank you.
Meanwhile, I would want to request all the participants. First, let Dr. Tanvi sir finish his lecture. Then we will take the question answer sessions. Of course, he would love to answer all your queries, keep your good questions ready, but wait till what I say. Wait till when sir says ask your queries, in between, please do not unmute yourself or don't start your cameras. That's a request. Thank you.
Okay. Sorry. So friends, today we are talking about the most important topic, 50 millisievert potencies. If I ask you, how many of you are using single dry dose method in their practice? Just answer me that in the chat box, because there are many people who are practicing homeopathy in different manner, but there are classical homeopaths who are giving one single dry dose and wait and watch for some time. Just answer me in the chat box so that I want to know how many of you, the audience and the participants, are using that method. Right? Now, coming to this topic, I will try to start with the 1 or 2, 3 cases, then we'll directly go to the topic, or I can go directly to the topic, then coming with the cases. Liaquat bhai, what do you suggest? Shall I go with 1 or 2 cases, then I can come with the literature part?
Yeah, better we start with the cases, so then the audience gets it.
Okay. There are many cases, but I will go with only 1 or 2 cases because of the. I will. This is a case of hepatitis A positive. Okay, I will share the main glimpse of the cases because much attention I would like to give on the case, this one, literature part also. This is a case of hepatitis A positive with a very high SGOT-PT. It is first time in my life that I have heard about so high level of these enzymes, SGOT and PT. This is a case of 15 years boy having a history of fever for 1 day, jaundice since 1 day. He had pain in the stomach, which was getting aggravated by walking, talking, jarring, pressure, breathing deep, etc. Appetite was there but could not eat. Thirst 1 glass every hour, large quantity, weakness he was feeling and desire to lie down. The medicine is very much obvious, and it is. I will bring down this photo slides also somewhere downside so that I can see the full screen. Okay. He ate some outside food from where he got this problem, and when he was tested for his liver function test, he was found having SGOT 4,760 and SGT-PT was 3,420. Liver was enlarged. Bilirubin was 2.8. Just see the reports, and after that, these are the report. You can see from the slides, from the reports, SGOT-PT. This is a hepatomegaly report.
It's 5:15.
After this, he contacted me and I suggested him not to take any other medication, and he was given Bariania 0/1 in LM potencies frequently. These were the rubrics and this was the repertorial chart. You can see and have a just look over the rubrics I have taken for this prescription. Bariania 0/1 was given. With this, the pain decreased a lot. Fever started coming down. I asked him to repeat LFT because in such cases, when I got the test done for this liver function test, the laboratory technician, he told me, doctor, who is the patient? I said, he is known to me. He said, you just don't take this case because it is a case of liver failure, and you refer this case to some big hospital like DMC in my Ludhiana in Punjab. So I said, okay, don't worry, I will try to handle it. Don't worry. I prescribed the medicine, and on the second day, I just got the report done. Then LFT was worse than yesterday. I asked him to get his HAV done. He was positive for hepatitis A. This is the antibody test. And after 2-3 more days, bilirubin increased, but SGOT-PT was coming down. You can see that if you see the date and all, 5th of October, the SGOT-PT has gone down. It is just now 1760, and SGOT-PT also you can see both the sides. But the bilirubin was going very high. This was the point when I wanted to review the case because I need to intervene with some other medication. I reviewed the whole case. You can see here SGOT-PT, they are coming down very nicely, but bilirubin is going up. You can see. In this, after giving the medication, bilirubin is also down from 8.14, then it is 3.97. This case was reviewed, and with all these symptoms which you can see and read, excessive weakness, always desire to lie down, appetite was decreased. If at all he eats, he wants spicy food. First wants to drink 1 glass of water every hour, but avoids due to nausea, so he drinks small quantity at a time, but frequently. Nausea on drinking or eating anything, he does not lie down because of fear of vomiting. He passes 3 to 4 times stools, and which was thin, watery stools. It happened after eating eggs. You can see the other things. And the mind, he was getting violent anger, that too at trifles. He decides to kill the person in his anger, anxiety about future as he has to appear in his exams. On the basis of these symptoms, I prescribed him China in various LM potencies. With that, he got very beautiful recovery. These were the rubrics for the prescription of China, Syncona 0/1 I started with. You can see the repertorial chart again here. What was present in the patient was present in my medication, my medicine China. It was given in 0/1 on 8th of October. You can see the dates. After giving this, you can see bilirubin is going down. It was 1.78, then SGOT-PT, you can see they are very much in the limit. And this is the whole summary of the lab investigation starting from 1st of October to 6th of December. With all that, he recovered beautifully without any hospitalization. These two medicines in various LM potencies, Brioni alba and Syncona, these two medicines, they took care of this patient, which were complete failure of the failure of the liver, and it was totally reverted. And at the end of this, after recovery of this case, he started getting slight itching over the hypochondriac area. It gets aggravated in the warmth, especially at night. For this, he was given Lycopodium 0/1. After this, he did not require any treatment. He is still in my contact and is well. So this is the beauty of LM potencies, because when we prescribe single dose, single medicine, then we have to wait and watch for the longer period of time. I will discuss the beauty and drawback of this method, because this was ordered by Dr. Hahnemann. He wrote it in 4th edition of Organon, which was written in 1829. So Dr. Hahnemann reviewed his whole Organon 4th edition, then he came up with the 5th edition. We will discuss those things later on. I will go to the next case. This is the case of pituitary microadenoma. It is very important case of my life because I got so wonderful, result in this case, that too within a span of almost 1 month only. So this is a case from Ontario, Canada. She is a married lady, 27 years female. This case was registered in 2008. She had chief complaints were headache since 2006. Location, she has pain in the deep center of head, just behind the nose here, behind this nose. It is more towards left side. She had sensation as if it is pulsating one. When it increases, she feels as if it will burst open. Sometimes she feels it as if squeezing pain, and sometimes as if constriction feeling. Modalities were aggravation by touch, pressure, motion of head, exertion by 9 p.m., lying on left side or painful side. It appears suddenly and decreases slowly. Concomitants were sleepless with the headache, and she gets fever with headache. It increases with headache. So I did all the LSMC, location, sensation, modality, and concomitants. These were the investigation report from William Osler Health Center from Ontario only. This report shows pituitary microadenomas. The size was 6 into 4 mm in dimensions. If the size increases from 1 centimeter more or 10 mm more, then it becomes macroadenoma. This is the classification. So it was microadenoma. She takes painkillers to for this pain. It gives only temporary relief. She took treatment from Canada without much relief also. Pain in the legs and forearms since 1 year. She had past history of typhoid various times, 4 times, and hypertension. Parents and maternal grandfather. Father and Dadi, they are having diabetes. Patient as a person, when I took the case completely, she's reported that appetite. She has good appetite, and when she is in India, but not when she is in Canada. When she comes to India, she feels good appetite, but when she is in Canada, it is not. She's not feeling like to eat because of the environment of the family atmosphere. So there was a desire, nothing specific or special, aversion for sweets, papaya and banana, thirst increased for large quantities. She sleeps, she avoids lying on back. It causes constricted feeling in the throat, so she lies on sides. But during headache, she can't lie on left side, so she sleeps on the right side. She can't sleep in the dark since this problem, this was important. She wants windows open or at least wants to raise the curtain to see outside. Dreams she has fallen into water as if she struggles hard to come out of it, but can't. She dreams of accident, frightful dreams she has, dreams affecting the mind. When she gets up in the morning, it affects them. It affects her very much. She keeps on thinking about the dreams. Am I audible to everybody, Lagat Bhai?
Yes, yes,
Dr.
absolutely.
Patil, am I audible?
Yes, sir. Yes.
Okay, okay. Is it okay the speed I am going with?
No, absolutely fine.
Okay, thank you. So I can make it slow or fast as you say.
No, it's cool.
So,
This is fine.
okay, thank you. So now coming to the menstrual part, she has suppressed the menses since July 2006 because we know that this microadenoma, it was in the pituitary gland where all the hormonal control is lying in pituitary microadenoma. So it also affected her menstrual cycle. LMP was 26 July 2006. She got only spotting in 2008 despite taking hormonal treatment. She started getting panic attacks after suppression of menses. She used to see the things and thinks that she had been there. She used to get scared of this. Why it happened with her? Perspiration was profuse and she was a heart patient. Mind, she was of very jolly nature, but now she is indisposed to talk. She likes sad music, which makes her weep, but she listens Nusrat Fateh Ali Khan and Jagjit Singh. She avoids to see the injured persons or accidents. It affects her badly, and she has fear of dogs also. So this was all about the patient, and the life space of the patient was her uncle was in Canada, working with someone in partnership. Brother of the partner invited her to attend his marriage. But just few days before this marriage, the refused for this marriage due to his bad character. Now the partner pressurized her uncle to prepare this patient for this marriage. As all the arrangements were ready, finally she got married with him, who was 10 years elder to her. See, friends, this patient, lady patient, her uncle was in Canada already, and he called her there in Canada. One of the partner of her uncle, which was there already in Canada, that partner, he was engaged with some lady, with some girl, but that girl, she refused to marry this partner because of his bad character. So every arrangement was done for the marriage, everything was fixed and ready. So this uncle, he pressurized my patient to get married with the partner because he pressurized her uncle to make her ready. She finally got married with him, who was 10 years elder to her, but after marriage, she did not spend a single day with happiness. Husband is very rude to her. He told her that you are not my liking and keeps on humiliating her intentionally. She used to strike her head with heavy books and sometimes to some sharp things also. Once she got unconscious with bleeding from head. Many a times she thinks to get separate from him. So I took the whole longitudinal history of the patient. These were all the rubrics I took into consideration. Any idea about the medicine? Rubrics are in front of you. Send it to the chat box, please, if you have any idea, anybody, especially the students or learning. Now coming to the repertorial chart. This was the repertorial chart, and after taking the differential diagnosis, Natrum and Staphylococcus aureus, the onset of pain and local modalities were missing in Natrum and Staphylococcus aureus. If you see here, Natrum was looking because of the emotional background, but Staphylococcus aureus is also very strongly coming up. It is very good medicine for humiliation and all. But they were the onset of pain and local modalities were missing. Calcaria car, the symptoms in the repertorial analysis, plus the pattern of onset of symptom is very important in this case because it comes very suddenly and goes very slowly. She cannot sleep in the dark. She is on an obese patient, dreams of unsuccessful efforts, dreams of accident, sadness from the reverse of fortune. Horrible things affect her very profoundly, and she avoids to see accidents. I need to take up. Moreover, the psychotic symptoms. So, prescription was made Calcaria carbonica 0/1 in water doses. And you see, Calcaria carbonica was given, and within 15 days, she told, and that headache is reduced by 50% now. She can sleep better, fever is very less now. She was given Calcaria carb 0/2. She got her periods on 7th of December after 26 July 2006. After 2 years and 4 months, still the flow is there. This time it is without clots. Earlier she used to get big clots also. Now no headache now. As she had to go back to Canada, she requested me to go for MRI as she felt almost free from the symptoms. I agreed and sent her for the same report because she felt that, doctor, I don't have any feeling of headache. I don't have any other anxiety symptoms, other symptoms which I have narrated you earlier. So she wanted to go back and requested me to send her for the MRI. I referred the case for MRI, and this is the report. After this medication, there is normal dynamic CMR, contrast enhanced magnetic resonance imaging, study of the pituitary gland. So this is the beauty of the LM potencies, because I was hitting her repeatedly 3 times a day with Calcaria carbonica in different potencies. So now menses stopped on 11th of December. She has no headache, sleep is good. She was given Calcaria carb 0/3 and was told to inform me if anything goes wrong. She was in my contact for a long time, but never got the recurrence of her symptoms. So this was the second case. This is the third case. Directly after that, I will go to the theoretical part. It's a case of chronic myeloid leukemia with acute exacerbation. It's a blood cancer case. Patient named X, Mr. X, 27 years male, a pre-diagnosed case of CML, chronic myeloid leukemia since August 2011, who was under allopathic treatment, visited my clinic on 1/1/2013 for his severe thrombocytopenia. Even after giving 5 STPs, that is single donor platelets, in last 10 days, his platelet count was just 12,000 on December 31st, 2012. Apart from this, she had other general symptoms of CML, that is fever, loss of appetite, apathy, swelling of the face, and severe weakness. In the beginning of November only 2012, the treating oncologist told his wife that the patient will survive only for 1 or 2 months at the most. This time was already over by now, because this patient was admitted in one of the famous cancer hospital in Punjab.
5:30.
Famous cancer hospital in Punjab, but after giving even 5 STPs in the last 10 days, his platelet count was not coming up despite all the efforts. So this patient, he was the person who even sold out his house for his treatment. So this patient, he took LAMA, leave against medical advice, and he reported me on 1st January 2013. This is a report from one hospital where it is CML and acute febrile illness with mucositis. It was done. So I took the whole case and prescribed. Again, in this case, Syncona was prescribed. You can see the result. It is very small and concentrated form of case taking. I just wanted to show the efficacy of the medicine. The whole understanding of the case is very, very long. I can spend 1.5 hours for the whole complete understanding of this case. Sometimes whenever time come, I can go to the detail of this case. How come I reached to the medicine China or Syncona? So you can see the reports here. When he came to me on 1st of January 2013, his platelet count was 12,000. TLC was very, very low, 2,600, and HP was also 8.5. With basophil count is 13. And as this one case goes by days, when this patient with his wife, they came to me for the first time, I took the case, prescribed the medicine, and she was asking me, doctor, we are giving him medicine for blood cancer that was Gleevec, imatinib Gleevec 400 mg. This is the drug of choice they give for the leukemia CML, imatinib. Shall we keep on giving the same medicine or not? I said, yeah, you can keep it going, give him along with my medication. But due to one or the other reasons, patient could not take medicine for first 4 days after starting my Syncona. And his wife, out of curiosity, she felt that now it is the 4th or 5th day. Why can't we see the change in the medicine? See here, after 5th day on 5th day only, this patient, out of curiosity, went and got his CBC done. In this, you can see the rise in TLC. Beautifully, it started coming up from 2,600 to 3,500. And for the first time, this figure was coming up. 46,000 platelet came without any STP, without any single donor of any platelet count was not given at all. And on 10th day, the same platelet count went up to 66,000. And on 17th day, he called me up from the cancer hospital from Ludhiana only, and his throat was choking. He was, because of happiness, out of happiness, he was unable to speak to me, and his voice was heavy. And he told me, sir, I am so and so, and I am so happy that my platelet count is 2,77,000, sir, now. I was not expecting this much of recovery in such small time. It was only 17th day of my medication. And he told me, sir, even my oncologist, because all of the reports were done in the same hospital where he was admitted earlier. And when he took this report and consulted his oncologist, then that oncologist was also very much surprised. He took back this patient to the laboratory technician again, and in front of his eyes only, he got the test redone in front of him. And that oncologist was also very much surprised and happy. How come it can happen? Because we were giving you every alternate day, the platelet count was not coming up. We are giving platelets to you. How come it happened? Then this guy, he showed my medicines to the doctor and said that, sir, I am using this medicine. So that oncologist advised this guy, please do not leave this medicine, because all this happened with the medicines you are using with this homeopathic medicines. So this on 28th of January, after 28th day, you can see HB is 9 and TLC is within the range. It is 6,400, and you can see the platelet count 3,77,000. There is no abnormal cells here. Basophils were totally normal now. So this is you can see the comparison of the reports. When he came to me, you can see the first report here. It is HB TLC, and you can see the platelets here. This investigation was done from the Mohandas Oswal Cancer Hospital. It is a very famous hospital in Punjab, especially meant for cancer patients. The same report, I also said the patient in the same hospital. Allopathic oncologist told him that your case is reverting from an accelerated phase to chronic phase. This was very important for us because, when we take the cancer case, particularly this chronic myeloid leukemia, it has different phases. When it starts, it slowly develops, and it takes the chronicity of the symptoms, that is known as the chronic phase. But after that, it goes into the accelerated phase, when all the pathological process goes very rapid, at very rapid pace. And this patient had entered into this phase, accelerated phase. And after that, there was blast crisis phase, which is the last stage of this case. But luckily, this patient was reverting from that, from accelerated phase to the chronic phase. So now I will not share the other cases directly. I will go to the this one. Critical part of this, because there are many cases I have in my this one. Now, coming to the topic, which is today's topic about LM potencies. Friends, am I audible, Dr. Patil, Dr. Dakat?
Yes, sir. Yes.
Yes,
So,
yes,
the purpose of showing these 2-3 cases was only to make an interest in the mind of the audience that how fast this medicine in those pathological cases where we keep on stacking our head and we are not able to get the results. It was the same story with Dr. Hahnemann when he was following his 4th edition of Organon. See, I will go to the chronologically all the lifetime, the whole journey of the evolution of the potencies we will discuss in very short time, within 5 or 10 minutes, then we will go to the other part. Now, 50 millisimal scale of potencies is the last gift of our master, Dr. Samuel Hahnemann. It is the outcome of his lifetime hard work. But it is very painful to say that even after more than 100 years of publication of 6th edition of Organon of medicine, very few of us are using these potencies. It is because of many reasons. One out of them is 6th edition is controversial for them. The second reason is rest of the homeopaths did not pay a serious attention towards 6th edition. First category of homeopaths says, how come Dr. Hahnemann advocate the repetition of the medicine so frequently in 6th edition? Because he is the one who taught that we should not repeat the medicine until the action of the given medicine is there. They think it was very abrupt change, so they do not accept it. This is the logic is given by many homeopaths. But if we study literature, we find that it was very steady outcome of these potencies after continuous experiments by our master. It's not abrupt change actually. For that, we need to fill the gaps of our information actually. We need to study the chronology of the evolution of dose and potencies. Now, what is the history of evolution of potencies? We know that longer we see in the past, further we see in the future. Until or unless we do not know how Hahnemann evolved the potencies according to the timeline also, how he practiced with what potency scales, then only we can understand that how important is 50 millisimal potencies and why. Now we know that, friends, just have a bird's eye view. Dr. Hahnemann did his MD in 1779, we know that. In 1781, he was appointed as a doctor at Gommeren, which is a very small area town in Germany, where he was using large doses of drugs. He resigned his position as a doctor from there because until now he was practicing allopathic medicines. According to the teachings, he was using his large doses of the drugs. Now, birth year of homeopathy comes in 1796. After discovery of homeopathy, Dr. Hahnemann was using medicines, though according to the law of simile or similibus curanter, but now also he was using a large quantity of the doses. We will share with you the grain doses even. And first time we find him talking about some hint about dilution. Started with large doses, then he said, no, we should dilute it. First hint we found in 1798 in his literature. In 1801, first detailed description about dilution and succussion in his article, Cure and Prevention of Scarlet Fever. We find in this that he was using the dilution part from the medicine, not the complete concentrated form. In 1806, he wrote one essay, What are Poisons, What are Medicines? In 1810, first edition of Organon came, where these aphorisms 237, 244, 5, 248, then 250, 252. All these aphorisms are about the dosage in first edition of Organon. Luckily, I have that edition with me. And in 1816, he is talking of now drop of a tincture. Earlier, he was giving in ounces in, in liquid form, more quantity. Now he's talking of drop of a tincture, not whole, ml or something like that. In 1821, he is talking of part of drop now. In 1816, if you see, he is talking of the giving so many drops as one dose. But in 1821, he says part of a drop, not only one drop also. That is, he started using globule just to, minimize the dosage. To divide the dosage, he started using the globule, wherein he was able to wet 100 globules with one drop. You just see, from one drop, he started giving 100 globules to 100 patients. Means those were not, one drop was given as a 100 dosage. In 1829, he wrote 4th edition of Organon, where there are two important aphorisms, 242 and 245, which are the actual base of the practice of many of our homeopaths even today, who are using single dry dose method. That is also known as wait and watch method, wherein we give dry dose to the patient and along with some placebos, and patient comes after 7 days or after 15-20 days. Again, we ask the patient, how do you feel? According to the follow-up, we see if patient is feeling better, then we again prescribe him placebo. As long as patient is feeling better, we do not repeat the dose, or we do not increase the potency. When there is definite relapse of the symptoms, then only we give the second dose. So it was the instructions given by Dr. Honeyman in 242 and 245. Let us study this aphorism 242. Dr. Honeyman says in this aphorism, as long therefore as the progressive improvement continues from the medicine administered, so long we can take for granted that the duration of the action of the helpful medicine in this case at least continues, and hence all repetition of any dose of medicine is forbidden. He totally stops to repeat the medicine as long as the action of the medicine is going on. In 245, he gives us instruction, even one dose of the same medicine which has up to now proved beneficial, if repeated before the improvement has begun to stand still in every direction, will, like an untimely interference, only aggravate the state. He says as long as the patient is improving with the given dose, if you just repeat the dose in between, your recovery of the patient will be interrupted. He says further, in one word, we disturb the amelioration affected and still to be expected from the first dose. If we give a second dose of the same originally well chosen remedy before the expiry of the period of action of the first, at all events, we thereby delay the recovery. So he says, as long as there is improvement, we should not intervene that. We should not disturb that. When there is definite relapse of the symptoms, then only. This is known as single dry dose method or wait and watch method. This method was, Honeyman was not satisfied, friends, with this. Next, I want to have take a pause here and just think if we are following that method still in our practices, which many of the homeopaths they are practicing now also, but Honeyman was not satisfied. Why? Because this method was taking long time to treat a patient. Due to the large quantity of the dose, there was homeopathic aggravation in the very beginning of the treatment only, when patient himself was in trouble. See, many cases, particularly if we take any dermatological cases, any skin complaints, if we prescribe any indicated medicines, few times or many of the times we come across with the aggravation of the skin complaints or any other complaints also, not particularly, that is more common in skin conditions. Patient comes and says, doctor, after taking a medicine, my whole problem was increased. So why when we listen this statement from the patient's mouth, we feel very satisfied, very relaxed. Why? Because we have been taught that after giving this medicine, if patient feels aggravation, then this is very, very good one. This is a good sign. Amelioration will be followed after this aggravation. So it's a sign of improvement according to this methodology. But Dr. Honeyman was not satisfied because he was talking about gentle recovery. Gentle recovery. He was looking for the gentleness, but it was missing in this methodology. At the same time, when he was using this method, Mr. Korsakov, he is father of homeopathy in Russia. He was his direct disciple, and few others started preparing higher potencies like 60, 90, 200, 1500.
It's 5:45.
They started preparing the higher potencies. But Dr. Honeyman wrote letter to those people, just don't go up beyond 30. This is why many of our today's prescribers, they prescribe almost in every case or most of their cases, they prescribe 30 potency. Why? Because Dr. Honeyman had given this advice to Dr. Korsakov and one more doctor who were using higher potencies, just don't go beyond 30 potency. According to this, Dr. Honeyman wrote letter to these people, Dr. Korsakov and one of his friend, in 1829. So just you remember the timeline also, which is very, very important if you want to learn this one, 50 millisecond potencies. The timeline is very important to understand because Honeyman started his practice with crude doses, mother tinctures, then large doses, then with dilutions, then with the part of that drop, then with the part of drop in globule, then even one single globule. So we have to understand which year Hahnemann was doing what. So now he wrote letters to these people, don't go beyond 30 potency, but this was the story of 1829. Now, in 1832, we find him writing about olfaction method. He wrote about this in the preface to the list of symptoms of antipsoric medicines by Bonnet-Gerson. It was a repertory of Bonnet-Gerson's antipsoric medicines. He wrote this preface in 1832, and Dr. Lehmann, who was one of his disciples, he says Dr. Hahnemann has practiced only with olfaction method for 9 regular months, exclusively, no oral medicines, only with olfaction. He practiced with the olfactory method for exclusively 9 months. Now, if you see after this 4th edition, he reviewed his 4th edition. He was in Ceutin only, in Germany only. This 5th edition was written in 1833. You know, friends, earlier when he used to prepare his medicines, he used to give 10 succussions for preparation of 30 potency or centesimal potency. Whenever we used to prescribe or prepare the 30 potency, how do we make? We take one part of the medicinal substance and 99 part of the vehicle, maybe alcohol, maybe saclac, right? And we give 10 succussions and we prepare one C potency, and from there we prepare the next potencies. So we used to give 10 strong succussions. But do you know that Dr. Hahnemann wrote in 1833 that now you should not give 10 succussions, you should give now 2 succussions, because 10 succussions are more stronger one. If you see, you can read it from aphorism number 270 and 280 footnote of 5th edition of Organon. I also requested that if you have this book with you, if you can see me, this is very wonderful book of Organon where you can find 5th and 6th edition combined in both. So you can understand and read the aphorisms for more better understanding in detail also. So in the same edition, he wrote that now the medicine should be given in solution form. Though he wrote about this to give medicine in the solution form in 4th edition also, but I was unable to find, because that time when I wrote this book, this is my book, I will show you in the end of my talk. At that time I was not having this 4th edition of Organon with me, but luckily I got it somewhere. I found that Dr. Hahnemann has given this instruction of using medicine in solution form in 4th edition also. So he wrote about this in detail in 5th edition of Organon in aphorism number 286. And in the same edition, he also wrote in aphorism 285 footnote and 288 footnote regarding olfaction method. I request everybody to read all these aphorisms, concerned aphorisms and footnotes to get the better and detailed understanding of this. Now, in this 5th edition, what was the major change and instruction by Dr. Hahnemann? It was Dr. Hahnemann wrote that here he prohibited repeating the medicines in cases which show progressive and strikingly increasing amelioration. Dr. Hahnemann says that when you find any patient, after giving the medicine, if patient comes and says, "Doctor, wow, wonderful. After taking your 1st or 2nd dose, I was getting, strikingly increasing amelioration. It is progressive one. आपने तो एकदम मिरेकल किया, वो जादू की पुड़िया थी वो, ऐसा पेशेंट आके बोलते हैं, डॉक्टर साहब क्या दिया आपने मुझे? It was, wonderful." So in those cases, when patient feels this sensation that I feel so rapidly increasing or strikingly increasing amelioration, when patient after getting 1 dose, he starts feeling, better very rapidly, very strikingly, very progressively, Dr. Hahnemann says, do not repeat the dose. But those cases which show slow improvement, he advised to repeat the doses at suitable intervals to speed up the cure. Friends, this statement may be very, very new to many of us, because those people who are using wait and watch method, single dry dose method, which I was talking about, 4th edition of Organon, those people, they repeat the dose only when the action of the given medicine, the action of the given dose is over, and when there is definite relapse of the old symptoms, then only people, they repeat the dose. But friends, Dr. Hahnemann has changed his posology in 5th edition of Organon. He says those cases which show slow improvement, he advised to repeat the dose at suitable intervals to speed up the cure. Now, even after writing this, Dr. Honeyman was not satisfied. Still, master was not satisfied with C potencies also. Why? Number one, centesimal potencies were not acting rapidly, according to his understanding, because after giving the dose, patient is not getting, sometimes the change in his symptomatology in most of the cases. Better if you want to understand it, if you read CPA from Dr. Kent's lectures, he writes there that after prescribing CPA, first week, second week, third week, patient was not, having any change. But at the fourth week, Dr. Kent was reported that now patient is feeling change in his symptomatology and feeling better. So there are a lot many cases we give the dose and patient is not feeling any visible change in the symptomatology. So according to Dr. Honeyman, he says centesimal potencies were not acting rapidly and they are producing violent medicinal aggravations in the patients with hypersensitivity especially, or with the patients having deep pathologies and with weak vitality, etc. Those patients who are hypersensitive, if we prescribe them little more higher potency, then they get very severe aggravation. I remember one case narrated by respected Dr. S.M. Singh of Allahabad. He was asked by late Dr. Dubey sir, S.M. Singh, have you ever prescribed graphitis in skin cases? Dr. S.M. Singh folded his hand in front of his guru, Dr. S.K. Dubey, and said, sir, I prescribed graphitis in my patient 2-3 times, but I faced severe aggravation of the patient's complaints. Once a patient came and he literally, he spoke in Hindi, वो मुझे जूता मारने को आया था ऐसा, इतना ज़्यादा वो patient को तकलीफ हुआ उसका. Then Dr. Dubey said, if you find any patient of graphitis in skin complaints, if you want to prescribe graphitis, do not give in centesimal potencies. You take these 50 millismol potencies vials, you prescribe these potencies and report me the results. And after giving the graphitis in LM scale, Dr. S.M. Singh sir said that I found so beautiful and so quick recovery in my patients. I was very, very satisfied and happy. And in deep pathologies, if we prescribe the centesimal potencies, for example, if we give lower potencies, many times those lower potencies in centesimal scale, they are unable to touch the depth of the pathologies. And if we prescribe little more higher potencies in such cases, then those potencies can cause killer aggravation. We find that in Kent's observation, if we read first observation only. So in those cases, we are very much afraid to prescribe. We find many instructions written by our stalwarts, do not prescribe kali carb, phosphorus, silicea, tuberculinum, and many other deep antisoric medicines in so and so diseases. So because of the fear of severe aggravations. On the other hand, lower potencies were not able to cure them. It was taking longer time to cure. Friends, when we prescribe centesimal potencies to our patients and patient comes after 7 days or after 1 week, he says, doctor, I am feeling better. We prescribe him placebo. When we are giving him one single dry dose or with the placebos, 1 or 2-3 doses of the medicine in the beginning of the treatment we give. You take this dose, once dose now, second one in the afternoon or after so and so times, 15-20 minutes also. After giving 2-3 doses, we give him placebo. After giving placebo, after 1 week or 10 days, patient comes and says, doctor, I feel very much better. We prescribe him again placebos. He comes again after 15 days. Again, patient comes, doctor, I feel much better, but the pace of recovery and the feeling is not that rapid one as it was in the first 15 days. So that time we ask him, okay, you tell me finally if you're feeling better or is there any problem with you? No, doctor, I am feeling better. Again, we prescribe him placebo. It happens 2-3 times because it depends upon the selection of the medicine, the depth of the action of the medicines. Patient comes and says, doctor, I'm feeling better. The time comes when patient comes, doctor, now I feel that I'm not feeling any improvement in my case. Then we think and ask him, okay, what about your generals? Appetite, thirst, desire, emotions, sleep, dreams, everything. He says, doctor, all are fine, but I'm not having any further recovery. Then only we give the second dose of the medicine, maybe same potency or maybe with a higher potency. So likewise, if we keep on giving placebos, it takes longer time to cure the patient. Practically, I have seen in my clinical practice, because I am practicing these medicines since last, since 2006 or 7. You can calculate the time. So I have compared the results also in my cancer cases also, that when we prescribe our LM scale potencies, repetition is done, we get quicker results. The same thing is written by Dr. Hahnemann also in 6th edition of Organon. I will discuss that part later on. So with centesimal scale, the time is a longer one when we treat the patient. Longer duration of action is also there, because when we prescribe any centesimal potency, the action of the medicine is very, very longer one. If you read the Boric Media Medica at the end of this, when there is a chart made, you can see the duration of the action is very, very deeper one. If we prescribe one medicine, it keeps on acting its own way. And the time of repetition is very, very difficult to know, because many times we are in also dilemma whether this is the time to repeat the medicine, or shall I wait for some time, because patient is feeling. So I was talking when he was in Koitin, he was happy with the practice, because people were ready to wait for longer time also from the village people, they were coming. But when he moved in Paris, and then people were not ready to wait for longer time. They wanted very quick results. So Dr. Hahnemann reviewed his whole 5th edition of Organon.
It's 6 o'clock.
And he found 3 options with him to change in the posology. What changes he can make in this one, in the posology, in the dosage method. The first one is the quantity of the medicine for the preparation of the new series of potencies. Because the aggravation part is because of the quantity of the medicine we are using for the dose. If we reduce the material part of the quantity of the medicine, then the chances of aggravation will be minimized. So he made that. Number 2, the ratio of the dilutant to the medicine. When we dilute the medicine more, then we can minimize the aggravation. But the number of succussions to be given in each scale of potencies, he found that if we increase the succussions, because first in the beginning he was using 10 succussions. In 5th edition he wrote to go to the 2 succussions only. But when he diluted the medicine, when he reduced the material part of the medicinal part quantity, then he found that now we have to increase the number of succussions for the preparation of the medicines. Now he was using 100 succussions for the preparation of any potency in LM scale. So the quantity was reduced, but the number of succussions were increased. Now 1837, he was in Paris. I say that this is a gateway year of LM potency, because he wrote his chronic diseases 3rd volume. If you read the preface to this 3rd volume of chronic diseases, then I am sure that all the myths and things about the authenticity of 6th edition of Organon will be totally removed. All the dust and myths from the mind will be totally removed, because this is the precursor of 6th edition of Organon, especially in concern with posology. In this book, in preface of this 3rd volume, Dr. Hahnemann wrote that if we give dry dose, it is the weakest dose, because this dry dose, it touches very few nerve endings in the oral mucosa. Then he said that we can have the split dose. Split dose means he used to take 7 to 20 tablespoonful of the water. 1 tablespoonful is 15 ml. Just mind it, please. 7 to 20 tablespoonful of water, and into that he used to put 1 globule indicated medicine, that too of the very small size, like mustard seed. So 1 globule in this much of the water, giving succussions, and from there he used to give the dosage, that is a teaspoonful doses to the patients. And Dr. Hahnemann used to give in acute conditions 2 to 6 hourly from that the solution which he used to make, 1 in 7 to 20 tablespoonful. And in dangerous cases where there is an emergency, he used to prescribe half an hour to 1 hour. And in chronic cases, he used to prescribe daily or on alternative. So this is the well-written, Dr. Hahnemann's handwritten document, which is there in chronic diseases, preface to 3rd volume of chronic disease. It's very easily available with BJAN. You kindly go through this. You will be very happy to and satisfied to read this preface, because I am sure after reading this preface, if you follow this instruction of Dr. Hahnemann, your whole practice will be multiplied in terms of getting much more quicker and a healthier response, that too without much aggravations. So I recommend this book to everybody. Because why I say that it is a gateway year of LM potency, because he was making the experiments with 30 potency only. Here 1837 until now he was using 30 potency, but he was using it in the fashion what we use in LM scale now, LM potencies or 50 millisecond potencies nowadays. If you see, Dr. Hahnemann has prescribed first time LM potency in March 9, 1838. If you find his register number DF6, page 145, Dr. Hahnemann prescribed sulfur 0/1 to a patient named Eugene. Though he was experimenting with both C and LM potencies in his later years of life, but he arrived to the conclusion in 1842, which he mentioned in the 6th edition of Organon. Now, if you see 6th edition of Organon, if you find, or you can read it, 246 aphorism from this 6th edition of Organon, Dr. Hahnemann clearly says in the footnote that what I said, it is very, very important. Just be with me, be ready, be careful to read every single word and try to assimilate it, try to perceive this. He says, what I said in the 5th edition of the Organon, comma, in a long note to this paragraph, in order to prevent these undesirable reactions of the vital energy, was all that he experienced, I then had justified. जो मेरा तब का experience था, according to that I wrote into 46th aphorism of 5th edition. But during the last 4 or 5 years, however, all these difficulties are wholly solved by my new altered but perfected method. Hahnemann himself praises his method. It is new, altered but perfected method. Which one? The new method. This is what we know is as a 50 millisecond potencies. And he wrote one letter to his publisher, Schwabe. I have now, after 18 months of work, finished the 6th edition of my Organon, the nearly perfect of all. 6th edition is nearly perfect of all. And in 24th March 1843, he wrote letter to Dr. Bonigerson. I draw your attention to the last edition of the Organon, which, if it is please God, will be published in near future in the French version. At least you will find it satisfactory in every respect. The German version will be difficult on account of my mortal enemy Trinks. So Hahnemann dies on 2nd July 1843, before the publication of this 6th edition. Now, after the publication, so now we're coming to posology. If we read 248 aphorism of the 6th edition of Organon, Dr. Hahnemann recommends daily and frequent repetitions in chronic diseases. In 248 aphorism. And regarding the preparation of medicines, how to prepare the solution and all, he writes about it in aphorism 248 footnote. Now, just see the statement by Bonigerson. He writes, Dr. Bonigerson writes in his lesser writing on page number 74, under the footnote of Aluminium Metallicum Medicine. He writes, in the new edition of the Organon, which will probably appear yet in the course of this year, improved and completed by Hahnemann himself, a new simplified procedure for the potentizing of medicines will be taught, which has considerable advantages over the former and yields a preparation as to the efficacy of which I can, from my own experience, give full praise. See, Dr. Bonigerson says that I give full praise to this new method because it has considerable advantages over the former. Former means centesimal potencies. I know this procedure, but according to my pledged word of honor, I am not as yet permitted to communicate it to anyone. So this is again one more authentication by Dr. Bonigerson that this is, all changes were made by Dr. Hahnemann himself. Dr. Hahnemann not only wrote this, Dr. Bonigerson not only wrote this, but Dr. Hahnemann sent 2 cured cases treated with LM potencies, which are there also in the same lesser writing. Now, coming to 50 millisecond potencies, there are different names: LM potencies, 50 millisecond potencies, Q potencies, water potencies. There are many names given by different people. They write it in a different manner. Someone says LM1, or in Roman they write it. Some people write it 0/1 in Roman or in Arabic form. Many people write it in Q1, Q2, Q3. Q means Cuenca Gita Emilia. But Dr. Hahnemann used to write it 0/1, 2, 3, as I have shown in the this one. Now, terminology of LM potencies, medicaments or globule, because these medicines are given in globule, not in the liquid form. Earlier one, they were medicaments la goutte, that is medicine in drops. So it is new dynamization method, new altered but perfected method, or newer dynamization. Dr. Pierre Smith gave this name 50 millismol potencies to this method. There are many things. Now we coming to the administration of LM potencies. Is it clear until now, friends?
Yes, very clear, bhai.
Okay, thank you. Now, coming to this administration, how to administer the LM potencies. Now, friends, if there is condition by Dr. Hahnemann in 246 aphorism only that there are certain conditions. If you fulfill that, then you can prescribe 50 millismol potencies. What are those? Number one, if the medicine selected with the utmost care was perfectly homeopathic. Medicine should be similar quarantary based, that is homeopathic medicine. Number two, if it is highly potentized means 50 millismol method we can study from the aphorism number 270 and 271 from Organon 6th edition. Dissolved in water, it should be dissolved in water, should not be given dry dose. Given in proper small dose. Every dose should be given in proper and small dose. Proper means it should not be decreased or increased. Suitable in definite intervals. There should be some definite intervals of in between the medicines. Now the last one is degree of every dose deviates somewhat from the preceding and following in order that the vital principle which is to be altered to a similar medicinal disease be not aroused to untoward reactions and revolt as is always the case with unmodified and especially rapidly repeated doses. Now there are 4 routes. We know that oral route, olfactory route, application through rubbing the medicine on the skin, and application of the medicine through milk of the mother or wet nurse. So friends, if you understand this, it is very, very easy. Now how to use the medicine through the oral route. If you read in detail aphorism number 248 and 272, you can understand the whole thing. But Dr. Hahnemann says in aphorism number 248 footnote, made in 40, 30, 20, 15 or 8 tablespoonfuls of water. You can multiply by 15. If suppose you are taking 20 tablespoons, it means 300 ml. If you are taking 8 tablespoonful of water, you can multiply with the 15 on it's almost 120 ml water. With the addition of some alcohol or a piece of charcoal, it is just to preserve the solution, not to get spoiled. In order to preserve it, if charcoal is used, it is suspended by means of a thread in the vial and is taken out when the vial is succussed. The solution of the medicinal globule, and it is rarely necessary to use more than 1 globule. This is underlined and bold by me, that it is rarely necessary. Only you have to take 1 mustard seed size globule. Okay. Of a thoroughly potentized medicine in large quantity of water can be obtained by making a solution in only 7 to 8 tablespoonful of water. We can reduce the quantity of water also according to the need. And after thorough succussion of the vial, take from it 1 tablespoonful and put it in a glass of water containing about 7 to 8 spoonfuls. This stirred thoroughly and then give a glass to the patient. So this is very, very important to understand how to prepare the solution. If you see in the picture here, there is one medicine here where my cursor is going. There is one small globule here. It is kept the indicated medicines globule here. We have to take 1 globule. We have to take 1 bottle. Ideally, we nowadays take 100 ml bottle. We fill it 3/4, maybe up to 75 or 80 ml ideally. We fill it 80 ml along with some drops of alcohol into this. Some drops means 15-20 drops you can put, or sometimes if you want to make it longer time, for example, if you want to repeat the dose at longer interval, then you can put more alcohol, maybe 1 ml or so. So the addition of alcohol into this just to preserve the solution for how long you want to keep this usable. We have to crush this globule which we have taken for the medicine as a medicine. For example, it is Lycopodium 0/1. We have to take that globule, we have to crush it with a with saclac, with milk of sugar. That globule, you put it in a sugar of milk, crush it completely, and then put it in the water, which is having 3/4 filled in a bottle, almost 75 or 80 ml, along with some alcohol into this. And after that, you just close it completely and then give 10 strong succussions. As if I am holding this bottle in my hand, you have to put one finger over the top of the cover of the bottle, and you have to hold this bottle strongly in your hand as if I am handling. You can see here how I am handling this. So you have to give 10 strong succussions on the hand, or you can take the rubber pad, or you can use some old book or kind of thing. From after this giving 10 succussions, now the medicine is ready for dispensing. Now from this 80 ml of solution, for one dose, you have to take 10 ml out of it. Dr. Honeyman says, if you are taking 120 ml of water, exactly as if Dr. Honeyman says 8 tablespoonfuls of water, then you have to take a bottle of 150 ml size, fill it with 120 ml of water, and from that 120 ml, if you take every time 1 tablespoonful, then it will be 15 ml every time. So from 120 ml,
It's
you can take
6:15.
from 120 ml, you can take 1 tablespoonful of 15 ml. But when you are using this 100 ml bottle with 80 ml solution into this, you can take only 10 ml of solution into a glass or cup containing 100 ml of water again, 7 to 8 spoonfuls. Okay, then you have to stir it completely, thoroughly. You have to completely, mix that water with this solution. And from this solution and water, you have to prescribe to patient 1 teaspoonful of the solution as one dose, and you have to give the instruction to the patient that rest of the water should be thrown out. Okay. And whenever patient is taking the medicine, the next dose, for example, your instructions are like you say, daily you have to give 1 dose from this bottle. Lycopodium 0/1, 1 dose you have to give every day morning. Patient will take 10 ml of this solution into a cup of water, having 100 ml water already into this. He will pour this 10 ml from the bottle solution of medicine, stir it completely thoroughly. Then he will take only 1 teaspoonful, 5 ml of this solution. The rest of the water is to be thrown. So before taking the dose, for example, tomorrow he has to take the same dose. Before taking the dose, he has to again give 10 succussions, 8 succussions, 10 succussions, or 12 succussions before taking every dose. This is what Dr. Honeyman says in 247 aphorism and 246 also. So this is how we keep on taking the medicine, using the medicine like daily 1 dose, or maybe it can be BD, it can be TDS according to the requirement of the patient. So when this medicine is over, the whole solution is over, then you have to prepare Lycopodium 0/2 in the same fashion as if we have prepared this methodology. And we have to keep him giving Lycopodium 0/1, 0/2, 0/3, as long as patient is improving with Lycopodium, as long as his medicine is Lycopodium, and as long as he is improving with the medicine. So we have to keep increasing the dosage, potencies only, from 0/1, then 0/2, then 3, then 4, likewise. And when patient finds any problem in between, for example, if he finds any, acute problem, then you can increase the dosage. Methodology is the same medicine which we are giving 1 dose per day. We can increase it to 2 or 3 doses per day, or even more also, what I do in my practice. But if the whole symptomatology is indicating some other medicine which is totally different from Lycopodium, then we have to stop giving Lycopodium. We can intervene with the second indicated acute remedy. We will give the same medicine according to the same fashion, but the repetition will be more frequent one. It can be 2 to 6 hourly, according to the fever, pain, or anything which is there, emergency also, we can increase it more frequently. So we can, after patient is over with this acute phase, we have to review the case, retake the case. If the medicine again Lycopodium, then we have to start the lycopodium from the potency where we have left him in the earlier. For example, he was taking lycopodium 0/3. So we have to start the case again. If the patient is indicating same medicine after acute phase is over, then we can go with lycopodium 0/3. Sometimes patient indicates some other group of symptom, then we have to take the whole case into consideration, prescribe the medicine according to the totality of the patient. So this is how we can give the second, this one, administration of the medicine with the oral route. This is the olfactory route. In this case also, Dr. Hahnemann says that you have to take the one globule and put it into one vial of 1 or 2 gram, maybe more also liquid. You have to put one globule in that bottle, then 1 drop of this one water just to dissolve this globule in the bottle, in the vial. The rest of the solution is filled with the rest of the bottle is filled with the alcohol, plain alcohol. Give again 10 succussions, strong succussions, and now patient has to only smell from the one nostril. He has to take normal breathe, and when he takes it inside, it is 1 dose. If you want to make it more stronger, you can ask him to take from the next nostril or from the third nostril again, 1, 2, 3. You can give him 1 or 2 or 3 breath according to the demand of the case, how strong medicine you want to give to the patient. So this is also very, very important when patient is not able to take the medicine orally. Maybe in coma patients, in COVID cases, in coma, that time I have used this method very frequently. In the coma cases, in the children cases, when patient is not able to take it orally. Application of the medicine through the rubbing on the skin in very old cases when patient is not responding to the indicated medicine. Along with the oral medication, we also can start giving the medicine rubbing on the skin. See, for example, we have dissolved that one, we have taken 10 ml of the solution into the cup of 100 ml of water. If I go to this back slide here, so from here only 1 teaspoon we have to give orally. The rest of the water we can apply on the skin of the body, which is free from the pain and eruptions. We should not apply the medicine on the areas where there is any pain or any eruptions. So this is the method, and the last method is, that application of the medicine through the milk of mother or wet nurse. I have not practiced this method very much, only very rarely. Whenever patient comes, then we prescribe the medicine to the to the mother only, who is lactating mother and giving milk to the baby. So as the sora, the miasm passes through the milk to the baby, the same way medicine's action goes to the baby through this. Now, regarding the selection of LM potency, before going to this, I want to ask you any question up until now, if you have any doubt, query, because most of the part I have made you clear, but the topic is still lengthy, having many more aspects and more areas, more things which I wanted to share with you. Yes, Liaquat bhai, Dr. Patil.
You can continue, bhai, if you have time.
Okay, I'll just give you some important hints so that you can do that. So for example, selection of LM potencies, though there are broad line guidelines are available in homeopathy how to select the potency, which are broad lines. So, but as far as LM scale is concerned, we can use those guidelines also in LM scale. But Dr. Hahnemann says in acute condition, in your chronic conditions, you can start every case with 0/1 with the lowest dilution available with you, lowest potency available with you. So there is no confusion. All the confusion Dr. Hahnemann has made clear in this LM scale. There is no problem that you are going with CM potency 50M, 10M, 1M, or 630 or 20. So he says that you start with from the lower dynamization, you can slowly make it up. Now, why to give succussions before administration of every dose? You can read 247 of Horizon. He says that our vital principle is not, happily receives or tolerates the same, medicines, the same potency repeatedly. For example, we have prescribed 30 potency to a patient who needs 30 potency. After giving 1 dose, the vitality, the susceptibility of the patient will be a little higher one. Okay, so at this higher level, this 30 potency may be matching or may not be matching. So if it is matching, then it can act here also. But after giving 3rd, 4th, or 5th or 10th dose, the vitality, susceptibility of the patient goes higher one. But you are giving the lower potency. Dr. Honeyman says, instead of giving the same unchanged potency, which our vital principle does not accept, rather it starts proving the medicinal symptoms. So it is better always to give succussions. After giving succussions, your dynamization or you are potentizing your medicine to the next level. So we do not get any aggravation or medicinal aggravation rather. When should we stop giving medicine to the patient? This is important, yes. So there are three conditions when we should not stop giving LM potencies to the patient. Number one is medicinal aggravation. What is medicinal aggravation? Medicinal aggravation is the aggravation which, after giving the patient any indicated medicine according to our perception, sometimes patient starts, developing some accessory symptoms which are not of the patient. These are symptoms of the medicine. It indicates that the medicine which we are giving to the patient is not the simillimum one. So that is known as medicinal aggravation. So in that case, you should immediately stop giving LM scale. You review the case, try with the better homeopathic medicine, which is having homeopathicity with the case. So this is one condition when you should stop giving your LM potency medicines. Number two, homeopathic aggravation. Homeopathic aggravation is nothing but the aggravation which is because of the cumulative effect of the medicine. What is cumulative effect of the medicine? In chronic cases and in acute cases, we find in acute conditions when we prescribe 50 millismol potency, sometimes if the patient is little, sensitive or hypersensitive, we find it in the beginning of the treatment. As we find with centesimal potencies, the aggravation is coming in the very beginning of the treatment only. But in chronic cases, when you are prescribing LM scale, if you suppose keep on giving lycopodium to a patient continuously, and patient is feeling better, the time will come when patient will feel the relapse of the reappearance of the old symptoms, not old symptoms, the symptoms with which patient comes to you for the first time. For example, patient came with you with, for example, this heaviness of the abdomen, indigestion, gas problem, flatulency problem. But you prescribed lycopodium, patient improved from every aspect. His generals are better, particulars are better. But after some time, maybe 2 months or 3 months, patient comes and says, doctor, I feel a little more flatulency in my abdomen, but I am feeling much better overall. So it indicates that now the medicine which you are giving to the patient is not required at all, because now the medicine has started giving his symptom to the patient. So this is known as cumulative effect, the all combined effect of the medicine. So in that case, you should stop giving medicine because patient is feeling better. When the symptoms with which the patient came to you first time, if they are coming back in a minor way, you should stop giving the medicine. Send the patient with some time for placebos. You just prescribe placebo for 15 days or 20 days. If patient feels better, it means patient is cured or at the verge of cure. If patient is having some more symptomatology, or patient is coming up with more violency of the symptoms, patient is getting more aggravation, that it means the patient needs more treatment. So that is the second point when we should stop giving medicine. Third one is, I have already explained you, when you find that patient is having progressive and strikingly increasing amelioration. Patient comes and says, doctor, after taking your first or second dose, I felt very, totally different. I felt very better. I felt very relieved. And not only that, when I took second dose and third dose, it was amazing. In those cases, you should instruct your patients, particularly when you're expecting this kind of recovery, so that whenever you find this kind of improvement or amelioration, just stop taking further dose from the solution and call me up. So this is what patients coming to me and telling their doctor, after taking our first, second dose, I was feeling wonderful. That time it is totally, negligency from our part if we do not instruct our patient to stop the medicine. Otherwise, we can spoil the whole case again. This is very, very, important. It is so important that, how the pilot of a plane, he lands his plane on the runway, and how meticulously he coming down on the runway. Now playing with the potency, playing with all these points is very, very important, like a pilot when he's landing on the runway. So we should keep our close eye on the follow-up of the patients. Now, what to do then? In case I have told you that in those cases, we have to stop giving the medicine. And prescribe only placebo for some time. If patient is feeling better, then it means he is cured. Otherwise, if patient comes with some more symptoms increasing day by day because he's not taking no medicine, if patient comes with flatulency, then again heaviness of the abdomen, then again eructation and more symptoms, then there might be some remnants of the disease are available now. We have to go with the higher potencies of the same medicine according to the symptomatology. So until now, this is what all about this one. 50 millismol potencies. Now, why 50 LM potencies did not get their deserving place? Why even after 100 years of publication of 6th edition of Organon, which was published in 1921 in German, and then in English in English after in 1922, why people are not giving attention to this? Why? Because many pioneers of homeopathy, they have not seen 6th edition at all. You can see the list of the doctors, you can see the life of these people, because 6th edition was published in 1921 in German and 1922 by Borick in 1922 in English. All these people, they had gone. Many pioneers who were alive also at the time of publication of the edition also did not pay much attention towards the changes made by our master. So these were all people, they were alive, but they could not give any much attention. They were happy with the way they were practicing. So these people were happy, but they did not pay any attention. The possible reason maybe they were not aware of LM potencies, that they might be satisfied with their prescriptions only with the decimal or C potency. The strongest reason was Dr. J.T. Kent. Yes, of course, Dr. Kent had, even has,
It's 6:30.
his strong influence over the people's mind, over the homeopathic fraternity, because his Materia Medica, unquestionable, repertory, unquestionable, his philosophy book. We love him, we read him, we practice him, we follow him. Because Dr. Kent dies in 1916, had he seen the 6th edition of Organon, which was published later after his death, then you would have seen the total entire difference in his publication, especially in his philosophy book. He would have written totally different way. But unfortunately, he could not see that because he dies first before this one. So because he was holding the flag of homeopathy in all, in the America, and people were following him. Even nowadays, we are following Dr. Kent very, passionately. So this was the reason. And the next was doubt about the authenticity of 6th edition of Organon. Many people, even today, I meet many people and they say, Dr. Tanveer, how come we can trust that 6th edition of Organon was, which is there with us, is the original one? Because it was, lost and found many times. There were many times, because of the, if you see the history of Organon, why it was published so late. I have written many articles also, it is there in my book. So they find it that there might have been changed some, paragraphs by Dr. Richard Hale, who finally procured this 6th edition of Organon from the family of Bonnicash later on, or maybe by Dr. Madam Melanie D. Harville. They might have changed some of the aphorisms and all. They have some doubt about the authenticity of the Organon, but they are those people who do not know about the preface to the 3rd volume of Chronic Diseases, which was written by Dr. Hahnemann himself and was, documented everywhere, that he was experimenting with the centesimal potencies, like in a fashion what we prescribe nowadays, LM scale. Organon of medicine nowadays is abundant one. We do not pay respect to doctor, this one. It is very, I'm so sorry to say that many of us, they do not pay much attention to the Organon of medicine. If we prescribe any medicine, if we find any problem, all the solutions, all the answers are in the 6th edition of Organon, in the or in the Organon, maybe 5th or anywhere. So we are not habitual to read Organon of medicine. We read every book, we read everything, but we do not go to the Organon of medicine. That's why we do not know what Dr. Hahnemann wanted to do us. And there is a distance from Hahnemann also. We do not understand. We read the literature of the Xerox copies of the people, but we do not understand. We do not read the original literature of Master Hahnemann, our old stalwarts. Once you start reading this literature, many of the dust and myths from the mind will be totally washed out. So these were the reason why LM potencies, they could not get the deserving this one. Many of us have gone to this extent that they have almost abandoned Organon as they don't pains to open it. They take bath daily, wash their faces. Once the leaves fall off the tree, friends, they become dead and lose their existence. Same thing is happening with many of our homeopaths. Our homeopaths should be attached with Hahnemann so devotionally and strongly that they keep on getting homeopathic nourishment from his literature, which is very much essential for the growth of homeopath as well as of homeopathy. But ask yourself, how many of us give a serious attention to this greatest discovery of Hahnemann? Why do not we take pains to study this new and perfected method of our old master? It is the mature mind of Hahnemann when he wrote his sixth edition. It is not the experimental phase now. Why are we not putting this method into practice to see its efficacy? Why do we practice even today wait and watch method of single dry dose, which causes undue aggravations to the patients and takes a longer time to cure? Why we keep on welcoming the painful aggravations of our patients' complaints, which can be avoided successfully? Why we do not think of providing gentle and rapid cure to our patients? Are we justifying our roles being doctors? Dear friends, it's our serious negligence towards the sick people, because when we have a new perfected method, then why we practice the old one? Suffering humanity is looking at the face of medical profession to help them out of their sickness gently and rapidly. You can also think logically. Dr. Hahnemann wrote 6 editions of Organon in his lifetime. Every present edition was discarded by the subsequent one. For example, when 5th edition came, 4th was discarded. Similarly, when 6th edition published, 5th was discarded. Logic says that now we should follow 6th edition of Organon. At the time of Dr. Hahnemann's death, he left his 3 medicinal chests. Out of these 3 boxes, 2 polished wooden boxes contained 888 vials of C potencies in the 6th, 12th, 6th, 18th, 24th, and 30 potencies, few vials of 200 potencies, and a large polished wooden case inlaid with ivory contained 1,716 vials of LM potencies. Most medicines are kept in 0/1 to 0/10 potencies. Only a few are up to 0/30 potencies. Dr. J.V.D. Castro from Chandigarh, he is no more now, he is late. My teacher he was. He wrote, I will not accept anyone who does not prescribe LM potency as a classical homeopath. Dr. L.M. Khan, sir, my guru, he says, LM potency or 50 millismol potency is an outcome of most mature brain with full of experience. We cannot ignore this scale of potency with our sterilized, dogmatic, prejudiced mentality, which has got no space in homeopathic profession, in practice or theory. So I really thank you all for this patient hearing and listening. And at the end of this, I would like all of you to read this from your heart. This is Hahnemannian Oath, which I have little bit modified, particularly the second paragraph. I request everyone to read in your mouth only. On my honor, I swear that. Am I audible, Liaquat bhai?
Yes, very much.
Okay, thank you. So, on my honor, I swear that I shall practice the teachings of homeopathy, perform my duty, render justice to patients, and help the sick whosoever comes to me for treatment. May the teachings of Master Hahnemann inspire me, and may I have the strength for fulfillment of my mission. On my honor, I swear that I will follow 6th edition of Organon of Medicine in my clinical practice and will administer the drugs which are prepared according to the instructions laid down in 6th edition of Organon to render quick justice to my patients and help the sick whosoever comes to me for treatment. May the teachings of Master Hahnemann inspire me. Thank you very much, everyone, for patient hearing. Thank you, one and all.
Beautiful lecture. What energy, what enthusiasm, my God. It's almost 90 minutes, 1.5 hours you spoke continuously. It's beautiful. One question I have for you, Tanvir, if you take the question.
Please, yes.
You said that you have to take 15. Yeah, you have to take 15 ml of the LM potency daily, right? You put it in 100 ml. So that means it's going to be like 8 doses from one vial, right? Like if you take 0/1, make it like, so then one vial will make only 8 doses of 0/1 potency, right? After that, you have to up the potency.
No, I'm telling you.
Okay. So after one, you can up the potency, right?
I didn't actually get the question clearly because your voice was also breaking a little bit. Hello, can you repeat the question, please?
You said that you have to put 15 ml of 8, like in 8 spoons of 15 ml, right? And then from there you take 15 ml daily and put it in 100 ml and take 1 spoon from that, right? And discard the remaining
No,
water.
I'm making it a little more simplified. I'm making it more simplified. I think I got your point. See, if you are taking, according to Dr. Honeyman, then you have to take 150 ml bottle.
Yeah, and then 120 ml put in that. That I know. So what I'm asking you,
That
so from one bottle you're going to make 8 doses, right?
you have to make 8 doses, yes.
That is it. That's what I was doing. So
This
after
is-
0
this
by
is
1,
what-
after 0 by 1, then
Yes.
you up the potency to 0 by 2, according to the requirement of the
according if the case is indicating with the same medicine. But I'm telling you the other method also, which I am practicing more in my clinical practices, because
Okay.
this method which I have explained to all of you is, which is written by Dr. Honeyman in his 6th edition of Organon. But practically speaking, when I started going to Dr. Ramalal Patel, sir, he used to do, you know what, he used to take 100 ml of bottle, he used to fill up to 60 ml of water. He
Okay.
was putting few drops of alcohol just to preserve it, and into that one crushed globule of indicated medicine in the sugar of milk, putting into this, giving 10 succussions, and out of this 60 ml of water, he used to give one dose as 10 drops in 30 ml of water.
Okay.
Why? Because this method is why practically so easy. For example, we nowadays we are treating some chronic diseases.
Yes.
For example, there are certain cases which are manageable only. You cannot cure them sometimes.
Right.
So we need to keep on giving the doses frequently. We cannot, our medicines are getting prepared by the pharmaceutical companies up to 0 by 30. Certain companies started giving up to 0 by 100 also, but there are very few medicines which are available for 0 by 100. So, for example, if you are making only 8 doses out of this bottle,
Yes.
and you are giving one dose every day or on alternate days, this 8 doses, it will go only for 50 days. So for
Exactly.
1 month you need two potencies, 1 and 2, and
Right.
for 1 year you need 24 potencies. So what would
Right.
you do for the next year? Because you are having
Exactly.
medicines only up to 50. So what Dr. Patel sir used to do is, he used to take this bottle for 1 month, this 60 ml bottle water. If you take only few drops, maybe 10 drops, can you get me that bottle? You have put the name. I'll show you the bottle which we are using here. So we are taking only 6 drops out of it, because our dropper is a little more wider one. Dropper is more wider one. 6 drops in 6 teaspoonful of water, almost 30 ml of water. Stir it and take it completely. There is no need to give 1 spoon, and the whole we can take it. So this is the bottle we are using for 1 month. This is 100 ml bottle.
Right.
Okay. So it is having its dropper inside only. Yes, yes. You can remove this. Also, yes. It is like this. You have to put this here, and after filling it here until 60 ml, give 10 succussions, and we instruct our patients to only take 6 drops out of it in 6 teaspoonful of water. This is more practically, which I found more flexible, because only for 1 month I need only 1 potency.
Right.
So 30 potencies, if I have, I can go up to 30 months. I mean, more than 2.5 years or 2.5 years almost. So this is more practically seen. I have seen with Dr. Ramalal Patel, sir. The other method which I have shown with this Dr. RP, this one Honeyman's method. If you are treating some acute case, there is no need to give frequent repetitions. Then you can repeat that method. That is easy, because you need not to prescribe the medicine for a longer time.
Yes. Yes. Perfect. Perfect. Very, very good practically. Yeah. This is what I read about Dr. RP Patel, sir. Yeah.
Yes. Because you know that I have been with him for long 2 years regularly.
Okay.
I have sit in his library in Vadodara from morning 9 to 9 in the night for 7 days, along with his cancer cases. He was kind enough to allow me to take his cancer reports of the files of the patients, and he allowed me to go into the upstairs in the library. So I used to go every month for 7 days for long 2 years. That's
Wow.
that's how I started treating cancer patients. Whatever I am doing is with all his blessings and his teachings. Dr. Raman Lal Patel.
Wow. You're lucky. You.
Yeah, I am lucky. He is honeyman of homeopathy in India. Everybody
Yeah,
sees.
yeah.
Who is
Yes,
the
yes.
person who made 35,000 collections in cancer laboratory? You can imagine the
Yes,
level of knowledge.
I know.
And level of his knowledge. He is
We
the
read his red. We read his red book.
everybody. We have read his red book. Repertory,
Red book.
repertory. We have appeared in exams after reading that book only. So it was his method which he made, and it is very much practically useful also.
Yeah, very nice.
So this
You're
is
very
that.
lucky, and you are you. I salute your devotion because you
Arre,
went all the
arre,
way
thank
from
you.
Malerkotla to Vadodara and sat with him for 1 week. And my God, that is
You
fantastic.
know, Liaquat Bhai, our Prophet Muhammad Sallallahu Alaihi Wasallam has given one instruction that you go to China if you want to learn anything.
Yeah, Ikra Bismika, yes.
Ikra bismi rabbika alladhi khalaq. So
Yeah,
you have to learn from everywhere. Wherever there is knowledge, you have to go there.
actually, very true.
I,
Very,
I
very
wrote
true.
one article in our Rational Physician now, which is this is our prestigious magazine. I also request you to send some of your cases, cured cases, into that magazine. I am the chief editor of that magazine, Rational Physician.
Wow.
Yes.
Okay,
I
sure,
am,
sure.
yeah. So I am the chief editor of that magazine. You can even request your students also to share your cases and all that. We can publish your cases into that.
Absolutely,
So
absolutely, absolutely.
my editorial was this time: be a passionate homeopath. Be a passionate homeopath.
It's 6:45.
Until unless don't have passion, you can't go to the heights. You can be an
No,
average
you can't.
homeopath. Yes.
No. Without passion, nothing is possible.
Yes,
You
Doctor.
will be just a mediocre.
Yeah. Dr. APJ Kalam very rightly said that if you want to shine like a sun, if you want to
Yes,
shine like a sun, you have to burn like a sun.
exactly. You must burn like a sun for shine like sun.
You must
Exactly.
burn
Very
like.
true. Absolutely. So
Okay.
beautiful, no? So nice. Salim bhai, we would love to hear from you again. And I know you've been very kind from your very tight schedule. You devoted, I know you had only 1 hour, but you extended, been very kind to extend it to one,
Almost it's going to
6:45. So yeah, thank you very much, Salim bhai. I have no words to thank you. But I would love to hear
you have complete right over me. You can ask me anytime. You are my brother. No formality, Liaquat bhai, with you, no problem. Anytime, any day, any moment. I'm always for the disposal of homeopathy and for you.
Thank you, Salim bhai. Thank you.
I'm so lucky to have few words with your students, with your colleagues, because I don't know everybody. I know you. So आप जो कर रहे हो, the work you are doing, you are teaching your students is commendable.
Thank you, Salim. So kind of you.
मैं किस को छोड़ूं, मैं किस का इंतखाब करूं, जो जरा जहां है वहीं आफताब है.
वही आफ्ताब है, बिल्कुल. Thank you.
तो आप अपना जो काम करते हो, you are also doing wonders. So thank you very much for working for homeopathy. I thank all of our audience for giving me this patient hearing and all listening. Thank you very much.
Tanvir bhai, I found purpose of life in homeopathy. I found my purpose of living. I found my purpose of existence because I've been in homeopathy. I always say we homeopaths are chosen ones. We homeopaths are chosen ones.
Yes. These are my everywhere presidential address. In my presidential address, I always say the same quotations. We are the chosen people.
Yes, we are the chosen ones.
We are the special people. We are the special people.
Yes.
We are sent here on this face of earth for the higher purpose of our life.
Exactly. This lecture is going to go on YouTube, Tanvir bhai. Right now, we have more than 3,000 subscribers on YouTube. And I'm very sure, mashallah, we have crossed 3,000 in less than a year. And I'm sure
you are doing marvelous, work in homeopathy. I know.
Thank you, Tanvir bhai. I would love to hear from you again because there are so many questions. Before your lecture, I was just discussing with my core team, and we have almost 25 questions, with which almost one hour of your will be spent. So we abstain from asking.
We can make one question answer session one day.
Exactly. So one Thursday, Dr. Pranita will call you, and any Thursday you tell. we'll be taking that question answer session.
I am so sorry लियाकत भाई, वो कितनी बार मेरे को उनका डॉक्टर पाटिल का फोन आता था, सर सर
हाँ.
सर. I was unable to reply in time, because of the so much busy
I know.
schedules,
I
everything.
know. I know.
So, but it's a great pleasure to be with you, to be with your students, your team. Salute to you also.
Thank you, Tanvir bhai. Thank you. Thank you. One thing I want to add is about, because I know I've spoken to many stalwarts of contemporary stalwarts, about 50 minutes ago. Many of them said that it happened after the death of our great Dr. Hanuman sir. See, what I understand why people don't accept LM potency, because we have that habit of being comfortable with what we have. We go on giving the thing. Second is, we are very much prejudiced about women still, because it was this thing. The manuscript was there with Madam Melanin. I think it was the wife of Dr. Hanuman. That thing, I know that is the only thing, I think, major thing, the prejudice of the woman, about the woman we have actually. But you have given the right,
I would like to.
all the proof about.
I would like to.
Yeah, you gave all the proof about where. Yeah.
Yes,
Salil bhai, please continue.
Can you believe me, Ragat bhai? I have made my 6 visits to Germany.
Oh.
I met those people who are practicing with LM potencies. I have been to Dr. Hanuman's house in Koithin for 5 times. I love to go
Wow.
there again and again, as if we people, Muslim people, go to Makkah and love to go
Makkah,
to
exactly.
again and again. So this is the book which I have written in 2013.
Yes.
Okay.
I've read it, Tanvir bhai.
You have read that?
Yeah.
Okay, very good. So now I am coming up with the second edition. It's almost completed with me, wherein
Great.
I have added so many points which I have left in this book, because I found 4th edition of Organon very later, which was not added into this edition. So I am coming up with many more new things also, and simplifying much more in a better way. Inshallah, next month I will send this for publication, if
Wow.
by the God's grace. Yes. So
That
yeah,
will be
this
very,
book,
very good.
this book is kept in Dr. Hanuman's house in his library. I'm so honored.
Wow.
I'm so satisfied. It is just left to his table and chair, as if this is my table and chair, and this side is his Almira, and this book has got place in that pious place.
My God, my God. You,
So
my
this
God.
is
Blessed.
there are many memories, and now we are planning to make one trip with this all places where Dr. Hanuman was born, went and practiced and dies, everywhere.
Wow.
So if you people or your students, anybody is
Of course.
interested to make
Yeah,
that,
of course.
I will be accompanying with you all.
Please do. Please tell us, Tanvir bhai.
It will be only for maybe it will be only for 8 or 9 days. We will go everywhere wherever Dr. Hanuman went. So
Absolutely.
we will enjoy the things. We will, I have brought the sand from his house. जो घर का मिट्टी है मेरे घर में रखा हुआ है, बोला
I
के
know.
वहां से
करबला की
तो
मिट्टी
वहाँ
लाते
पे जाके
हैं। माशाल्लाह.
वहां पे तो कोई भी चला जाता है, anybody goes to his house, he becomes homeopath. It is so strong vibrations you will feel there.
Oh, mashallah.
Strong aura of Dr. Hanuman. Even he is no more there, but if you go there, you come out of the house, you will feel that positive energy.
My God. Tanvir bhai, count
Yes.
on me. I'll be there with you in the trip, inshallah.
Inshallah, possibly July.
Sure.
This coming July.
Yes. Absolutely. I'm there. I'm there. And
And
many of my
I
students.
request our audience, I think many of might have left also, but I request everybody to join IIHP also, wherein you can get the platform to various exposure with various speakers.
Yes.
Yes, very good practitioners, I mean. So we can do that also.
Absolutely, Tanvir bhai. I've told my students actually to do that, but
Yes,
today again I
yes.
appeal. This is going on YouTube again, so I appeal all to join IISP, of course, because that is one of the most authentic and
It's an academic platform actually.
the
It's an academic
organization which
platform.
is really working. Yeah,
This is
it's a very
academic
good
platform.
academic platform. And it is
Yes,
doing
yes.
great work for homeopathy in India. It is doing great work for homeopathy in India.
We are
Yes,
continuously
Tanvir bhai.
doing that. Yes. We are continuously doing that.
Absolutely. Thank you. Shall we wind it up, Tanvir bhai?
Please go ahead, please.
Thank you very much. Thank you very much, friends, for joining. And Tanvir bhai, they will be asking questions on YouTube. We have a system. They will ask the questions on YouTube where you have the lectures. I'll be sending you the questions. If possible, you kindly answer that on YouTube. If
I'll
possible.
try to. I'll definitely try to come back. Yes.
Whenever you get the time, I'll send you the link. I think it will be uploaded in a week. Okay. So after that,
Okay.
I shall send you the link. Dr. Pranita will send you the link. And surely I would be honored if you answer every audience's
I
question. And of course,
I will
friend,
try to. I will try to.
yeah,
I will
and
try
friends,
to.
Dr. Tanvir sir is coming again. We'll be announcing the schedule very soon. He'll be coming again for question answer session. Okay. So don't worry. May God really bless you with long, long life and Tanvir bhai. And you keep writing books, you keep writing, keep doing the research. We are lazy people, we are more into practice. You do the research work for us, Tanvir bhai. We are really blessed to have you, mashallah. And I am so lucky that you're my brother. I'm so lucky
Thank
that you're
you.
my
Thank you. Thank you. Thank you very much. I'm honored. I'm honored. Thank you very much.
Tanvir bhai.
Thank you, one and all. Thank you very much, friends. Thank you. Thank you.
Thank you. God bless. Bye bye.
Thank
See
you.
you
Thank
guys.
you.
Thank you, sir. Thank you so much.
Thank you very much. Thank you.
Thank you, sir.
Thank you. Thank you.